Welcome to this video on hemodynamic monitoring for advanced resuscitation in the emergency department. Our learning objectives cover foundational concepts like differentiating between static and dynamic parameters and understanding tissue oxygen delivery. We will also explore clinical applications of non-invasive and invasive monitoring tools for critically ill patients. We begin with the basic vital signs and the importance of clinical context, emphasizing that interpretation should go beyond just the numbers. Key macrocirculation basics include mean arterial pressure, the primary driver of organ perfusion, with a goal above 65 millimeters of mercury. The shock index is a highly sensitive marker for occult shock. Remember that single values are snapshots, while trends show the movie of resuscitation. Markers of tissue perfusion are essential. Serum lactate indicates anaerobic metabolism, and base deficit measures metabolic acidosis. Capillary refill and mixed venous oxygen saturation are also crucial parameters for guiding resuscitation. End-tidal CO2, sometimes called the poor man's cardiac output, provides immediate feedback on pulmonary blood flow. It is useful for monitoring CPR quality, detecting return of spontaneous circulation, and assessing the severity of metabolic acidosis. Point-of-care ultrasound, or POCUS, serves as a visual monitor, moving away from static central venous pressure measurements. Dynamic fluid assessment includes the Cavell index, assessing the lungs for B-lines, and visually assessing cardiac contractility and LV volume. Arterial pressure monitoring offers beat-to-beat precision, which is the gold standard for labile patients and essential when titrating vasopressors. Waveform analysis, including the dichrotic notch and pulse pressure variation, provides further clinical insights. The magic number for the shock index is 0.9. A shock index greater than 0.9 is highly predictive of the need for massive transfusion and increased mortality, even if the systolic blood pressure appears normal. Monitoring trends in resuscitation is vital. Success is defined by a positive trajectory in perfusion markers, such as lactate clearance and an improved shock index. Here are some clinical pearls. Always correlate vitals with physical exam and tissue markers. Use dynamic assessments for fluid responsiveness. Get an arterial line early in shock, as manual blood pressure readings can be unreliable. Finally, remember the rule of 100s in sepsis. Thank you for your commitment to medical education. You can find my contact information on the screen. These are the image sources used throughout this video.